Yes, Senator Matthew.
Mr. Speaker, I don't know why the CS for Health would want to take us in rounds. The question was very specific. Now that you admit that you are aware of the case of baby Ariana Wairimu from Nyandarua, who succumbed to Pearson's syndrome, the question was very specific. Is it true that SHA paid 26,600 out of a bill of 23,000, and 620 out of a bill of 1.6 million? That was a very straightforward question. First, tell us whether that is actually a fact that SHA paid 23,000. Then we shall get to the second limb of the question. Why would you say that then SHA is working if it has paid such a negligible amount of money out of a bill of 1.6? And maybe, Mr. Speaker, finally, because I have been following and I've been very, very, the parents of these particular kids are my friends. I know that, I know Lewis, the father to the girl. The family and his friends have on their own, out of their own contributions, spent more than 10 million to take that baby to India. And the government had not paid anything. So the only one last time that baby Ariana wanted SHA, the one that has been praised that is very working, the only one time that she wanted SHA to work is when she has succumbed, because out of the many bills that we have had, she was being treated in India. There was no way the government of Kenya would have helped her when she was being treated in India. So, Madam CS, tell us, is it true that SHA paid 23,000 for baby Ariana Wairimu out of a bill of 1.6 million? Don't tell us stories that SHA worked where, SHA worked where. This is a specific case, and you say that you are aware of it.
Yes, Gerard Gay.
I think, Madam Minister, through the Speaker, you know, this is a premium platform. What we are seeing in social media, you should put it to rest before where you're having a forum. We are asking a simple question. Baby Ariana Wairimu had a bill of 1.6 million. There is allegation that 23,000 has been paid. You have all officers around you. Why don't you consult so that, you know, we don't use social media hype to confirm that SHA is not working? And then finally, through you, Mr. Speaker, sir, Madam Minister, just be specific. Are these funds under Social Health Authority working? Because in your answer, you have only said about the claims of Chief, and you have said nothing about the other two. Can you just confirm before the nation? If you do not have the answer at the moment, just ask for more time so that you can bring. Because as legislators, we don't want to join the rest of choir people who are saying SHA is not working. We want to protect your job.
Senator Mandako.
Thank you very much. Honorable Speaker, mine is just to inform the CS, just in case she's not aware, the CEO of SHA is actually seated somewhere in the gallery. Maybe with the help of the Sergeant at Arms, he can be ushered down to consult with the CS so that we can get an appropriate answer.
Senator Onyonka.
Mr. Speaker, first of all, I want to say thank you for giving me this opportunity. What I would want and I would pray for before I make my contribution. Mr. Speaker, the majority leader has pronounced himself. I believe that this discussion that we are having in this House is futile. It's an exercise in futility. Because the questions we have are close to 30. Like me, I've not even asked her who are the owners of the financial platform. You know, she's insisting that the SHA and Chief are working. The reality is that everybody in our republic is talking about how that system doesn't work. In fact, I even want her to explain to me why NHIF was removed from providing the basic services. We knew that NHIF had issues of corruption and mismanagement in terms of the payments which were being, we knew all that. But you see, Mr. Speaker, what has happened is, I see the CS really struggling. Can I make a special request? Because I had the majority leader make a contribution, and indeed, the speaker who left before you came in did not pronounce himself what we need to do. I believe that this matter cannot be interrogated on the floor of the House. Maybe we need to have it in committee so that we can spend even a whole day to run through the figures, to ask those critical questions, because everything I hear here, Mr. Speaker, is like this whole exercise is just a confusion and a rearrangement of things which I don't even understand. And Mr. Speaker, I'm not very literate. I'm averagely somebody who's been to school. So can we, as a Senate, ask the CS so that she can go and prepare herself, so that she can bring we go through this with a tooth comb, so that once and for all, we may be able to decide, is it working or it's not? If it's not working, we go back to NHIF and fix it so that it continues working, because NHIF was doing better than what is happening right now. Thank you, Mr. Speaker.
Senator Hamida, and please be brief. We need to move to the next question.
Thank you, Mr. Speaker. For me, I will. In fact, I just want to remind Madam CS and even the PS, Harry, who was there, that I told you, make us your friends. We shall work with you. Convert us. I mean, have time with the Senate. In fact, I'd even offered that we shall mobilize through my chair, Senator Mandago. We shall mobilize the senators only and have time with us to take us through, then we'll understand and we shall walk the talk. But unfortunately, that has not been done. Just a quick one, Madam Waziri. The standoff between the private and the government, the same SHA, I mean, looking at the digital claims right now, they're being processed in a way that they have been plagued with failures, Madam Waziri, forcing providers to revert back to the manual system. And also, you're talking about the success story and the success rate for patients' verification problems are still there, Madam Speaker. So kindly just address the standoff between the private hospital and the government hospital for the date of how you're planning to resolve the crisis. Thank you.
Senator Joe Nyotu.
Thank you, Mr. Speaker. I join my majority leader in saying that the Senate should be given equal recognition, if not more recognition, by the ministry, especially because health is devolved. I only hope and pray that that is not aimed at maybe preparing ground for laying off some people, Mr. Speaker. But coming to my question, especially regarding the baby from Nyandarua, I would like the CS to tell this House, Mr. Speaker, what SHA is doing for patients whose medication is not available locally, Mr. Speaker. And I say this because there are very many rare diseases. I don't know whether she knows about Gaucher's disease, which is a rare disease and whose treatment is not available locally, and where aid is given, Mr. Speaker, there are very many charged by the government from those donors. So what exactly is the position of rare diseases, especially those whose treatment is not available locally, and what is SHA doing about the same with specific reference to Gaucher's disease? Thank you, Mr. Speaker.
Finally, Senator Wambua.
Mr. Speaker, as the Senate, I'm grossly and completely underwhelmed by the responses from the CS. And I want to join my colleagues, Mr. Speaker, to request the House to direct that the Speaker, the CS, makes arrangements to appear before a committee of the whole House so that he can engage on issues, especially on SHA and SHIF. The Speaker, lastly, I don't know whether Senator Madago saw the right person. I don't know that person. I would actually feel insulted if the CEO of SHA was seated at the gallery when the CS is responding to questions about SHA on the floor. That goes, Mr. Speaker, to show the contempt with which this ministry treats this House. Mr. Speaker, if that is the case, then
Senator Wambo, would you like to be informed by Senator Wafula?
he can inform me later. After this, he can inform me. So, Mr. Speaker, if that's the case, then, Mr. Speaker, it's terrible. Really, this is very terrible. Mr. Speaker, let's arrange to have a meeting of the Committee of the Whole so that we engage with this CS. I thank you.
Very well, Senators. Very well, Wafula, I'll give you that opportunity.
Thank you, Honorable. Give me my mic. Thank you, Honorable Speaker, for this opportunity for me to inform my Honorable Senior Member that Honorable Senator not afford every staff to be seated here. So it is important that your message is at home, but the home is not at home. Thank you, Honorable Speaker.
Senators, give him the mic.
Don't run away from the response. You have informed me. The Speaker, choices have consequences. Choices have consequences. The CS must know who should sit next to her when she's responding to specific questions. You can never have a CS surrounded by other officials of the ministry when the CEO of the institution that we are questioning is seated in the gallery. Mr. Speaker, that is as simple as it gets. The chairs could have been occupied by the CEO of SHA, and then the rest of the officials would have filled the rest of the SHA. I thank you for the information.
Thank you, Senators. We have to proceed. I'll give Cabinet Secretary an opportunity to respond to all the matters that were raised, and then we proceed to the next question.
Yes. With regards to baby Ariana, SHA has not received an invoice from Fortis Hospital, India. Upon receipt, SHA will review and make payments of what is allowed according to the benefit package. But I really thank you and acknowledge the things that have been discussed, and especially the way forward in regards to
Honorable Senators, order. You asked the questions, please pay attention to the answer. Senator Mandago, Senator Wafula, please let's listen to the CS in silence.
For us to meet the committee and engage possibly in a retreat or for a whole day session. That way we can be able to flesh out, identify where we can work together. As I said earlier, we really need to collaborate. We need to work together so that we can have SHA being a success and UHC really being a success in Kenya. So we appreciate the comments and we look forward. My team and I will be reviewing and giving you a date and possibly just to engage and see at your own convenience when we can convene and discuss, deliberate further so that we can really ensure that Taifa Camp is a success.
Thank you, Cabinet Secretary. I think, Cabinet Secretary, you've made quite a number of commitments to this House. We would expect you to provide a written response to all the matters that were raised by the Senators, the ones you did not have adequate answers to. And also, you had made a commitment to provide a report of KEMSA and the other reports that you've committed to, which we'll expect that you give it in 1 week. Let us, Honorable Senators, now proceed to the next question by Senator Hamida.
Thank you, Mr. Speaker. My questions, Madam Waziri, as follows. Number one, have medical interns been paid their monthly stipend? Their monthly stipend up to date, and if not, could the Cabinet Secretary explain the delay and state when the government will streamline the process to guarantee timely payments? Number two, what is the ministry doing to improve the working conditions for medical interns who currently handle heavy workloads and work for extremely long hours under intense psychological pressure? Number three, could the Cabinet Secretary provide an overview of the support systems and programs currently being implemented by government to address the physical and mental well-being of medical interns. Number 4, could the Cabinet Secretary also explain what the government is doing to ensure that the mentorship program of medical interns effectively integrates both professional development and emotional support? I thank you, Mr. Speaker.
Cabinet Secretary.
Honorable Speaker and members of the Senate, in the financial year 2023-2024, the ministry was to post 3,759 interns as per the matrix below at a cost of 4.8 billion for the 12 months, but there was no budgetary allocation for the second cohort that was to be posted in January 2024, and this delayed the posting. The ministry consequently requested the National Treasury, with our letter reference number MOH Fin Budget Volume 1, 15, dated 12 September 2023, for additional funding to cater for posting of the aforementioned second cohort, which the National Treasury, with their letter Res 1083-2301A of 9th October 2023, indicated the funding could not be availed due to the tight fiscal space. Following the end of the industrial action by Kenya Medical Practitioner Dentist, Pharmacy and Dentist Union, which culminated in the signing of the return to work formula on the 8th May 2024, the parties engaged in negotiation on the matter of posting interns. The negotiations resulted in an agreement to post the interns with effect from 1st August 2024. Further negotiations on the payment of interns saw the parties agree to effect payment as per CBA 2017 rates. With regards to the government's effort to streamline the process and ensure timely payment, the ministry has formally engaged the National Treasury to facilitate the prompt and adequate release of funds to support seamless operation. And the ministry is working closely with stakeholders to establish a clear, pre-agreed framework for the posting of interns and the modalities of their engagement, ensuring efficiency and predictability in the process. Regarding what the ministry is doing to improve the working conditions, Honorable Speaker and members, the Ministry of Health is working with the KMPDC, and it has implemented a range of policy and regulatory interventions to safeguard the mental health, well-being, and overall welfare of medical personnel, particularly medical interns, taking note of the strenuous nature of their learning context. The key measures undertaken include centers to appoint dedicated personnel responsible for conducting regular mental health screening and ensuring access to qualified mental health professionals. These professionals provide essential guidance, training, and psychological support to interns, fostering a healthier work environment. This initiative has greatly improved mental health awareness among healthcare providers and the broader medical community, reinforcing the importance of mental well-being in high-pressure clinical settings. Furthermore, mental health professionals stationed at training centers play a vital role in supporting interns, offering timely interventions and addressing emerging concerns. To enhance coordinations, these professionals have been working closely with KMPDC in managing cases that require specialized mental health interventions. Secondly, there's enhancement of welfare and support mechanism, and all healthcare institutions are mandated to establish comprehensive welfare programs, including structured mentorship framework, chaplaincy services, and peer support structures. These measures aim to create a conducive work environment where medical personnel may freely express professional concerns without fear of victimization, reprisal, or undue prejudice. Thirdly, regulation of workload and rest periods. In strict adherence to the Employment Act 2007, the Occupational Safety and Health Act 2007, and other applicable labor and medical internship regulations, the Ministry and KMPDC require all health facilities to monitor and regulate interns' working hours. These measures are designed to prevent excessive workload and mitigate the risk of occupational burnout. Through these initiatives, the ministry reaffirms its commitment to safeguarding the psychological well-being of medical interns, ensuring they receive the necessary support to navigate the demands of their training effectively. Part C, where you ask for us to provide an overview to the support system and the program currently being implemented by the government to address the physical and well-being of interns. Honorable Speaker, honorable members, the Ministry of Health in Kenya has implemented several initiatives to support the physical and mental well-being of medical interns. First of all, we developed the National Guidelines on Workplace Mental Wellness. That was in October 2024. And these guidelines aim to promote mental well-being and establish robust support system for employees and health professionals in training, including medical interns facing mental health challenges. The ministry advocates for mental health prioritization in workplaces, calling for their united effort, urging investments in mental health clinics across level 4 hospitals, the implementation of these guidelines by employers, and the incorporation of mental wellness programs into school curricula. Secondly, integration of mental health into primary care. Acknowledging the shortage of mental health professions, the ministry has taken proactive steps to integrate mental health services into primary health care. This strategy enhances access to mental health support, ensuring that individuals, including medical interns, can receive timely interventions within community-based healthcare settings. By embedding mental health services into primary care, the ministry is equipping frontline healthcare providers with the necessary skills to identify, assess, and manage common mental health conditions. This approach strengthens early detection and intervention, reducing the burden of specialized mental health facilities. Medical interns in particular benefit from this integration as they receive both training and direct support in recognizing and addressing mental health challenges. This initiative fosters a more supportive and responsive healthcare environment, promoting overall well-being. Additionally, the ministry is working to enhance collaboration between mental health professionals and primary care providers to ensure seamless referral and comprehensive care for individuals in need. Thirdly, clinical guidelines for mental disorder. In July 2024, the ministry launched Kenya's first clinical guidelines for mental disorder. These guidelines, along with the Mental Health Gap Action Program e-training, aim to improve the identification, diagnosis, and management of mental health conditions, thereby enhancing the support available to medical interns. In addition, the guidelines for the management of common mental disorders, along with the Kenya-adapted version of the World Health Organization Mental Health Gap Action Program, aim to close a 75% treatment gap by improving the identification, diagnosis, and management of mental disorders at the primary care level. They include comprehensive strategies for diagnosis, treatment, and referral of clients, including medical interns who may require these services. For oversight and regulation, the KMPDC, in collaboration with the Ministry of Health, is responsible for enforcing clear guidelines on working conditions and hours for medical interns. This oversight ensures compliance and accountability across healthcare facilities, aiming to improve the working environment for interns. These initiatives reflect the government's commitment to enhancing the physical and mental well-being of medical interns through comprehensive support.